And it is Nurses Week. We've been celebrating it and talking about it this week. Today, within Nurses Week, is School Nurse Day. As we've reported, school nurses are in high demand as the nation deals with a shortage of professionals across the board. Dr. Adi Angelov is an author and CEO of the Paramount Health Data Project. Thank you for taking some time to be with us. In October, I know that you published an article. It was regarding the importance of school nurses, the need for them, particularly in this post-COVID climate. What did you find out in your research?
So yeah, we're very excited to be celebrating school nurses today. They are hugely important to the livelihood of a lot of kids, especially kids who are navigating poverty, whether that's rural or urban poverty. We know that school nurses are their #1 point of care. And so the reality is, school nurses provide care to kids in ways that, a lot of times a board-certified pediatrician or an emergency room can't. Mm-hmm. And what we have found in our research is that they also play a critical role in helping students achieve both in literacy and math. And so as we think of COVID learning loss and all of those things, the nurse really is an academic partner in helping sustain any gains. We're getting ready to start summer school. And so having that data before summer school starts, being able to provide really strategic care based on some of the data that a school nurse can provide, and then using that data throughout the year to sustain those summer learning achievements, and specifically in literacy and math, are hugely important.
How is healthcare connected to academic success?
Yeah, I know it's an interesting tie, right? I think most people understand that if kids aren't healthy, they're not going to learn. And education and healthcare really do have a shared mission, vision, and intent, right? Like to make sure that kids are holistically healthy and well. But the reality that we have found in our data is that school nurses play an intricate role in understanding what kids need in order to be growing and learning in literacy and in math in more strategic ways than we've ever done before. So
I oftentimes remember as a child too, the school nurse playing almost a therapy role for mental health. You go and there was a comfort there. I don't feel well, or I'm tired, and you go to the nurse and you receive that comfort care as well that you might not otherwise have. How are you seeing the nursing shortage affect negative outcomes here?
Yeah, obviously the school nurse is a really important point to send kids to get mental health. They recognize the difference between a kid who's just trying to get out of class, who may be suffering from a mental health issue, versus a physical issue, right? And so they can really make that decision. So they're really important in leveraging mental health in schools. But what we also see is that school nurses really do a nice job of making sure that we have data to make those decisions more effectively so that we can leverage those services. 40% of schools in Indiana have a board certified full-time nurse. The rest of them do not. So the shortage is really, really there. Schools also really struggle to figure out how to pay for school nurses because they're really competing with medical entities, hospitals, to match those salaries. So the school nurse shortage is really, really drastic, and we know that that affects academic achievement.
And really quickly, we're about out of time, but I have to ask you, what specific solution do you see here?
Yeah, so at the Health Data Project, we have a partnership with the Department of Education, and what that allows schools to do is to use that data as part of their academic decision making and leverage Department of Education dollars to pay for their school nurse so they can offer a more competitive wage. So we like helping schools, one, have better data for decision making in the classroom, but also be able to pay for those school nurses when they're struggling to do that.
Dr. Angelov, thank you so much for your time and your perspective. It's much appreciated.
Thank you.